transferring programs into a human biology program. And I was doing that with a lot of nutrition courses, but I still had no idea of what I was going to do. So it felt like every other week I was coming up with a new career. I was going to go into physiology, I was going to become a dietitian, but nothing was really sticking at all. And then I was walking through the university center one day, and they had a post-grad fair on. And my friend stopped to get information from one school, and next to it was the Canadian College of Naturopathic Medicine. And I was bored, so I picked up the brochure and I started reading about it. And it was just one of those moments where it felt like everything clicked. I really wanted to work in the medical sciences and work with people, but I also wanted to be working more towards health rather than just dealing with sickness. And I love the idea of looking at people's lifestyle. I wanted to look at the other underlying cause of disease, not just have that one complaint per visit policy. So it really seemed to fit very well for me. So I finished off my degree and I applied to the school and I got in. When I graduated, I decided that I was going to go back to my hometown, and I started working with a chiropractor, and we were working in opposite hours at that point. But really quickly sort of learned in the first couple of years that we both wanted to be working at around the same time. So we were unable to do that at that point, and I decided to look for something different. And I ended up working in a medical center actually for about 4 years, working with a compounding pharmacy. We have a teaching clinic there, so we had a lot of pharmacy students coming through, a medical clinic, a gynecologist, and it was a really fantastic experience for me. And then I took my own clinic, although I have to say it's only 2 doors down from them, so I've stayed associated with them the whole time. But through that, I also ended up working with, lecturing at a lot of universities in Canada, and I've been working with a lot of groups, with research groups in the natural health and nutraceutical programs, health promotions. We have an anti-aging group at one of our universities, and because of that, I've been able to do a lot of interprofessional work as well with the medical residence program that we have, the family healthcare teams, and it's really made for a great collaborative effort that we have in my community, and I love that side of things. But the biggest area that's probably come up for me is I was invited to work on an advisory board for a pharmaceutical company. And I do have to say, when I got the email asking if I would come in and interview, I did have that question of why on earth would a pharmaceutical company want to work with a naturopath? And then why would a naturopath want to work with a pharmaceutical company? As it turns out, they have a really strong presence in the area of the human microbiota, and we're doing early work with probiotics, which was something that they wanted to start working more with natural practitioners. So I had the great opportunity to start working with them, and that sort of led me into the direction of, in addition to my clinical practice, doing a lot of work on the side of the human microbiota. So my day-to-day life, I am in practice usually 3.5 days a week. I do have a goal in the summertime of only being here 3 days, although usually there's a lot of extra stuff that I'm doing as well. Often I'm seeing patients about 9 hours on those days. And then I have my time consulting. So between speaking for the Canadian College of Naturopathic Medicine, the guest lecturing that I do, and continuing education, I probably have about 25 to 30 speaking events that I do a year. And then there's other volunteering that I do as well, and writing and my continuing education. So it does make for a pretty busy lifestyle, but I absolutely love what I'm doing. And I think this side of the human microbiota, or these bacteria that live in and on our bodies, is becoming a really important area. And especially for naturopaths, I think this is something that we can really take hold of, and it really helps in a lot of areas of health with the way that we work with people on a day-to-day basis. There have been a huge number of changes. When I started in my undergraduate degree and taking my basic biology courses, even though I took microbiology and anatomy and physiology, I didn't learn anything about sort of this concept of the microbiota other than we have infections and that's bad, and we give antibiotics and that's good. Then when I went to school to become a naturopath, it still was very early on. So at that point, we knew we had bacteria and infections were bad, and we gave antibiotics sometimes, but sometimes we gave them at the wrong times. And even when we did give them, it could cause problems. And then we would give a probiotic, a good bacteria, and that was sort of the end of the conversation that we had. And there was very much the idea that bad bacteria are bad and good bacteria are good. Now we're starting to learn a whole lot more. There's still, it's almost like looking at very deep water, aquatic sort of things, where there's so little that we know, and it's such a vast area that we have to learn about. But right now we're starting to learn about all of these bacteria. We don't know what makes a healthy person yet and what their microbiome looks like, but we do know that some bacteria seem to have very beneficial effects, some have very negative effects, and a lot we don't know. But we actually have about 100 trillion bacterial cells in and on our bodies, which means that cell for cell, we're probably about 90% bacteria and 10% human. Thankfully, we outweigh them by mass, so we look the way that we do, but a lot of our functions have been co-opted to these bacteria. And there's this idea, Justin Sonnenberg, he's a great microbiologist in this area, has said that basically we as humans are an elaborate vessel optimized for the growth and spread of our microbial inhabitants. This is obviously a little bit tongue-in-cheek, but really we have a very symbiotic relationship. We have to work together, otherwise neither of us will really survive. And it's estimated that if we didn't have the bacteria that we have in and on our body, we probably wouldn't live beyond childhood, because we have so many of these functions in our body that the bacteria actually do for us and control. So why should we care about these microorganisms? We know things that they can be involved in infection. Most of us know that they're involved in digestion and GI health, at least on some level. Most people have taken an antibiotic and they felt pretty sick. Sometimes you might have loose stool or you might get an upset stomach. We can see if we kill off some bacteria, we get problems with the digestive tract. But we now see that it's related to irritable bowel syndrome and Crohn's and colitis and celiac disease and all of these different areas. We also know that it's involved in our inflammatory response. So things related to pain or things related to non-alcoholic fatty liver disease, our immune function and development. And this is really important in the first year of life. This is when we're training our immune system to lower our risk for things like infections, but also autoimmune conditions and asthma and allergies and things like that. And then we're seeing areas that we never thought about previously. With mental health, there's ideas around the microbiota and anxiety that actually a naturopath named Alan Logan put out a theory paper over a decade ago, and now we're starting to see the research that's backing that up at this point. Weight management, we're seeing a huge amount of research that's going on in how the bacteria are actually involved in whether we're overweight or not. Skin, urogenital, vaginal, cancer risk like colorectal cancer, some vitamin production. The bacteria are heavily involved in all of these types of areas. So how do we actually get these bacteria in and on our bodies? Previously, these slides that I had would have said that bacterial colonization occurs at birth. We are actually learning now that the fetus actually does have some interaction with bacteria in utero, but the majority of when they're going to start gaining this 100 trillion bacteria is going to happen at birth, and that's through skin, the oral cavity, vaginal interactions, and the GI tract. That is all going to happen at birth. And that's going to set the tone for the rest of life, and especially through that first year, this is where we're really getting the GI tract and the immune system primed. So this picture just came out from a study that came out just in the past couple months titled The First 1,000 Years Intestinal Microbiology of the Early Life. And what it's looking at, and I know it's a little bit hard to see pictures like this just on a screen, but what it's looking at is from the time of conception to adulthood, what's happening. And the biggest things that we know is that the immune system isn't very strong when we're born, and our gut isn't working as it does as an adult at this point. And one of the big things that's going to happen is we're going to get this introduction of bacteria that come in, and this is going to help our GI tract function properly, and it's going to prime and train our immune systems for the rest of our lives. So things that are going to change that, and a lot of this is what we as naturopaths do, and these are the things that we care about. So it's really important for us. But birthing issues, we know that if children are born C-section versus vaginal birth, we're getting differences in the microbiota. So children who are born by a vaginal birth, and I realize this can kind of have an ick factor, but when they're born and they come down the birth canal, they're going to pick up the bacteria from mom. Interestingly, we actually see that the mom's gut bacteria migrate from her gut into the vaginal area, and that's going to help a developing baby with their gut and their immune system. Babies who are born C-section, and those numbers are just increasing, unfortunately, we're seeing that their first inoculation with bacteria is going to happen from skin, so either from the parents or the hospital staff, and then the hospital setting environment. So we know that those babies are more at risk for things like obesity, asthma, and allergies, as well as type 1 diabetes. Breastfeeding is another huge area that we're looking at. So as naturopaths, we're definitely encouraging breastfeeding. The World Health Organization, and I know in Canada as well, we recommend breastfeeding for 6 months now. And that's something that we are transferring bacteria from the mom to the baby in that manner, that we're not going to have that happen in formula feeding. The babies aren't able to digest food properly, so we need to have this liquid food. What we also found out and sort of didn't understand was that in breast milk, there is something called human milk oligosaccharides. And these are specific types of carbohydrates. And we found it really odd that that happened. And we found it really odd because as humans, we can't break down these oligosaccharides. So it almost seemed like there was a mistake that was happening. But as it turns out, those oligosaccharides are the food for certain types of bacteria, and especially Bifidobacteria infantis. And so what we're doing is we're feeding those bacteria that are going to help down the line with digestion and a baby's immune system and training, so that we're going to be able to prevent disease down the line. The next biggest area that we're going to see is introducing food. So we're going to hopefully breastfeed for 6 months, and then we're going to slowly transition into food. And as it turns out, food is one of the biggest areas that is on a day-to-day basis going to change how this microbiota lives. There was a great study that came out of Nature earlier this year, and they had 2 groups of people. One, they fed, and this is insane, I realize, only animal-based food products, and the other group got only plant-based food. And we saw that there were statistically significant changes in the bacteria within a day of putting in this diet. So it's something that this is the biggest control that we have on a day-to-day basis, and something that's really not focused on in westernized medicine. So introducing real whole food and I would say no processed food is something that's really important for getting this appropriate microbiota and training our immune system. What we're also seeing, medications, things like antibiotics, obviously, but also proton pump inhibitors, those medications that we're using for acid reflux. These are things that are hugely changing our microbiota in a lot, making us have less bacteria than we had, or less types of bacteria than we had previously, and also putting in the risk for antibiotic-associated resistance. We're also seeing a lot of antibiotics being used in agriculture, and this is one of the areas where we have huge links to the obesity epidemic. Hygiene hypothesis, another area that we have to consider. So we're trying to bubble wrap our kids at this point, and the immune systems aren't training properly. We're seeing more links again around allergies, asthmas, autoimmune conditions, eczema. Things that we actually want to have is basically getting out in the dirt and playing outside, getting into nature, being around animals or farms. Even things as simple, there was a study that came out that it was beneficial for moms to clean off their baby soothers in their mouths. We have to start avoiding those antibacterial products because they're not giving us benefit, and they seem to actually be harming our microbiota, which in turn harms our own health. And then we're seeing changes in diversity and extinction. Overall, we have less diversity as people in North America than tribal groups or hunter-gatherer societies. Even in second world countries and third world countries, we're seeing we don't have as many bacteria anymore. And we also don't have as many types of bacteria compared to paleofecal studies where we're looking at historical fecal samples, and we just don't have as many types of bacteria anymore, and this seems to be a huge issue. And we're killing off bacteria, and in a lot of cases we don't even know we're doing it, and that means that we're putting our health at risk and not knowing what might be going on. So as naturopaths, we really need to care about this. The idea of that we're just human, we can't do that anymore. We are absolutely going to be looking at ourselves, but also looking at that microbial health. And I think as naturopaths, because what the things that we look at are going to be obviously things around immune and digestive health, but we take it back a step more and looking at the cause. It's the food that we eat, it's the water that we drink, it's the medications that we take or inappropriately treat things when we're not looking back at what the cause really is. These are the things that we really do, and it's a big part of the future of healthcare right now. So I do think it's such an important part of things. And it's something that on a day-to-day basis, this is what I'm seeing in my office, is all of these things seem to be linking back to the human microbiota. We can't separate us from them. So recently, I had a 5-year-old boy coming in. Over the last year, he had been complaining of tummy pain, which comes up a huge amount. Bloating, gas, irregular bowel movement. His parents tried lactose-free milk. It seemed to help a little bit. They did a probiotic with a prebiotic, which is the food for bacteria. That really didn't seem to make any changes. But he had so many of those things that we want to go in a certain direction in that first year of life not happen. They had an emergency C-section, wasn't being able to be breastfed for the full 6 months. Food introduction did not go well, a lot of digestive issues going on, and he had multiple rounds of antibiotics in the first year of life and into childhood as well. So while there was no testing that had been done on him in the sense of a colonoscopy and things like that, which I don't think was necessary, it pretty much seemed like he had irritable bowel syndrome. And what we did was we looked at the dietary side of things. So there's a diet called a FODMAP diet, and for those of you who aren't familiar with this, please don't feel you have to remember this, but it stands for fermentable oligodimonosaccharides and polyols. These are basically carbohydrates that we as humans can't completely break down and that the bacteria love to eat. And if the bacteria are out of balance because of certain things that may have gone on, like being C-section or the antibiotics or getting sick all the time or whatever it was, sometimes we get more bacteria that produce hydrogen gas and methane, and we can see these IBS-like symptoms come up. So we took out all the foods that can feed those bacteria, and it turns out his symptoms went away in 3 days. So we know that there's a problem with the microbiota then. But he had a birthday party, and he ate cake and ice cream, and all his symptoms came back. So when he came back, we talked about it. We did a full dietary change for a month at that point, and we tried to give back some of those good bacteria at that point. And what we saw after a month was that he had been doing really well. We started a slow introduction of some of the foods. He still had some problems with dairy, but otherwise was doing really well. And I think this is something that, this is an area that we're all going to be looking at as naturopaths, but it's something that it's a really good link to us and working with other professionals because it ties into everything. It ties into the medications, it ties into digestive complaints, it ties into obesity, and we can't take that apart. And it's something that I don't want to live in a world that doesn't have westernized medicine. I don't think it's an either-or situation. But when people ask me why I decided to become a naturopath, For me, it simply is, I think there's a huge difference between living a long life and dying a long life. And as a naturopath, we work on quality of life, not having a tummy ache when you're 5 years old, or being able to pick up your grandkids, or not being obese. It's not just about triaging care in a hospital. And I think that's really important. But before I finish up, I think that one of the things that's really important about being a naturopath is also having a fantastic practice. And this is a hard one because none of us get into this because we actually want to be fantastic business people. We're interested in health and people and natural research and looking at the underlying cause of disease and all of those things that I had on that day when I read the brochure. We don't care for the most part about the business side of things. But it turns out it doesn't matter how smart you are or how right you are about healthcare, because I do think that we're right, if you can't get that information out there for people to hear it and for people to show up at your office. So I did a lot of things wrong at the beginning. I will say I did a tremendous amount of things very wrong at the beginning, and it made it really challenging for me. I would say you've got to plan while you're in school. You're going to have time for volunteering or preceptoring or going in externing at clinics that are outside of your school. And that's a great time to learn skills from other practitioners who aren't just your TAs and professors. But this is when you're also going to learn how to practice when you're done. You want to make sure that you're meeting people. You can get out and do talks in the community. You want to network and you want to start getting patients and figure out where you're going to be. I, like a lot of students, waited to the last 4 months to figure it out, and that's a horrible plan. So make sure you do your homework ahead of time, make your connections. Those are the people who I see have done by far the best and start their practice out running and are making money. Learn to public speak. I based my entire university career on not public speaking because I did that thing where you turn red from the chest up and my voice would shake and the saliva would build up in my mouth and then I would leave. It was something that I absolutely did not want to do. As it turns out, I do a lot of public speaking. I think because it was hard for me, it was something that seemed insurmountable, and it's absolutely not. It's a skill the same way learning dissection is a skill or learning to add is a skill. But it's something that, other than actually getting my degree and becoming a naturopath, has been the best skill that I have had as being a naturopath. Because it's something that whether I'm speaking and introducing something in front of a board, or I'm doing a public speaking event, or I'm just talking one-on-one with my patients, the confidence is a whole lot different, and that's really important as being a naturopath. And finally, treat your business like a business. It is something that a lot of times we just want to help people, and we really don't look at the nuts and bolts of what and that's something that, again, it's not things that we want to get into necessarily, but the accounting stuff matters. The advertising dollars matter. You've got to figure this out. So I am going to say absolutely pay attention to your business classes. When I graduated, I picked 3 naturopaths that I thought were doing fantastically and invited them out to lunch so that I could pick their brains about things. Probably I should have listened better, but it was something that you want to work with people who know what they're doing and have done really well, because those people aren't only going to be fantastic naturopaths, they're going to be great business people. And I think that's what we have to do, is we have to be able to be fantastic as naturopaths, but we also have to get ourselves out there so people can learn about what we do and why it is so very important. So I think I just hit my 25 minutes right now. So I'm going to stop talking right now and see if anyone has any questions at this point. But thank you very much for listening, and I'm going to pass it back over to Kiki.
Okay, thank you, Dr. Bretz. Okay, just one quick thing I wanted to go over. A couple upcoming events we have. I just want to let you all know that you are invited to the AANP Public Days on August 8th and 9th in Phoenix, Arizona. AANP Public Day is a great opportunity to speak to professionals working in the naturopathic medicine field and learn more about accredited ND schools. The annual AANP conference convention is held by naturopathic doctors, AANMC staff, pre-med students, and naturopathic medical school faculty. And to register, you can just log on to our website at aanmc.org, and you should be able to sign up from there. So we will now open the floor for questions. Please keep in mind that questions related to the presentation will be given priority first. So Dr. Bretz, the first question that we have for you is, what do you think about bacteria found in healthy placentas?
So right now, I think it's something that we don't know very much about. I think it's something that we're seeing it is really important in the development of children to have the healthy bacteria, but we don't know how to translate that into what to do later on medically necessarily. Right now, even with fecal microbial transplants, we're really getting held up with legislation and things around that. So I think that first, we're going to have to see a lot of research, and second, then legislation is going to have to change, because anything around human tissues has very, very sticky legislation, both in Canada and the US.
Okay, thank you. And the next question, what is your best advice for school children in public schools and daycares to stay healthy?
Honestly, I would say I actually have a lot of things. There's probably not just one thing that I would suggest. I think for the schools themselves, getting kids outside is so important. And I don't care whether that you live in an area that it's going to be cold in the wintertime or not. We need to be getting kids outside, whether it's raining or snowing or hot, obviously keeping kids safe, but we need to be in nature a lot more and getting more exposure to the outdoor environment. I think food is one of the biggest things. I think schools need to take responsibility around food policies, because that is something that's changing the microbiota, our immune systems, and our gut on a day-to-day basis. I think, again, both in Canada and the US, we have sort of co-opted food to corporations, and whether that is coming through lobbyists and government, we have such a society of processed and packaged foods that are disguising as health foods. And when we have processed foods, when we have things in cans and boxes that last for exponential amounts of time, it means that we have killed off the bad bacteria, but we've also killed off the good. So I think kids need to be eating real food on a day-to-day basis. And then we are seeing some strain-specific probiotic studies that are showing that we can improve kids' immune systems with probiotics as well. Although that, I think, is not necessarily, I don't think that should ever be in the hands of the schools or the school boards. I think it has to go back to the parents at that point and making educated decisions with a healthcare provider and the parents.
Okay, thank you. What are some of the best strains of bacteria to look for in a probiotic? How do you feel about probiotics that claim they do not need refrigeration?
So I think there's a fair amount of processing that has to happen to make probiotics that aren't going to die without refrigeration, at least on a certain level. So I'm always a bit cautious about that, but if companies are doing their research and they're able to prove it, then I guess I'm holding a little bit of judgment there. But I think that the whole idea around probiotics is something that's changing. So it used to be the idea that all good bacteria did all good things and bad bacteria caused infection. And now we're starting to realize that specific strains seem to do specific things. And that has some variability in there, but what I tend to look at most are going to be strain-specific studies. So what we'll see is that if we're looking at, I'm trying to think of, well, if we're looking at someone who's in a hospital setting who's had an antibiotic, what we're going to see most commonly is studies that are showing that certain strains of Lactobacillus acidophilus, CL1285, and LKCI LBC80R would be good ones. We're going to see that for IBS. We're often looking at the studies around L. plantarum 299B. So it's going to be different for different conditions. We see a lot of studies for kids. We're going to see L. reuteri protectus is a really common one for a lot of childhood conditions, including regurgitation and diarrhea and constipation and things along those lines. So I don't think it's just there's one good strain of bacteria necessarily. But I also think another area that we have to be looking at is things like fermented foods, the water that we're drinking. All of it sort of comes together, and it's not just about probiotics necessarily.
Okay, thank you. Have you seen objects in feces that come from the body and are not pill causings or food? Can your body make things like this?
Sorry, I didn't hear the first part of the question.
Have you seen objects in...
objects in feces?
Yeah.
Do you know what? I haven't heard of that, really. Certainly, we're seeing things like blood or feces coming up, or, as sort of was mentioned in the question, that they weren't looking at undigested food particles. We definitely do stool sampling in my office, and we use labs to sort of check things out. So there hasn't really been anything that's coming up in that sense. But it's certainly interesting if we are seeing things that are being formed. I'm just not familiar.
Okay. How do you feel about bottled water versus filtered water and tap water?
Do you know what? I've been thinking about water a lot lately. I would love it if I could live near a mountain stream somewhere in an area that I didn't have to worry about contamination at all. I think there are a huge amount of issues with water. And one of the reasons that I was thinking about it a lot recently was that I've been looking a lot at fermented foods and some of the benefits that we're seeing. So I decided to go to a sourdough bread making class. And in the community that I live in, the woman was talking about the fact that we used to be able to use tap water to make sourdough bread because you could leave it overnight and the chlorine that was in the water would off gas and it wouldn't be there anymore, and it wouldn't be able to kill off the bacteria that you were making in the sourdough starter. But we couldn't use tap water anymore in Kitchener-Waterloo because it's chloraminated now, and chloramine isn't a gas, so it doesn't off gas. So if you use that water to make sourdough starter, the antibacterial properties in the water are going to kill the sourdough starter, and you won't be able to use it to make bread. So I started thinking, what does that mean for those of us who are drinking this? Because a lot of bottled water is going to come from tap waters from other communities. So you can live in Milwaukee and it turns out that the lovely bottled water at your convenience store just happens to be from a suburb in Chicago. Filtering, it's taking out some stuff, it can take out some bad stuff, it can take out some good stuff. So I think that right now, I try to use most commonly a spring water, or we're filtering tap water a lot of the time. I try to avoid things that take out too much of the good from water as well. I think there's no fantastic answer right now because water is either treated a lot, and that can be to the detriment of our health, or there's a lot of contaminants in it and we're still running into problems. But for my sourdough bread, I use filtered water to get the chloramine out of it.
Okay, excellent. What advice do you have for an ND who is just getting started with their practice?
I will say, first off, the first year of practice was the scariest year of my entire life. It was a time when all of a sudden you're thrown into the deep end and your friends are scattered across the country in a lot of cases, and you don't have the protective safety net of your school anymore and the library, and you're actually going out and doing it. So first of all, it's just going to be scary. So kind of accept that part of things. I would highly recommend that you're setting up a network for yourself of other naturopaths. For me, it doesn't matter whether they're close by you necessarily, but I actually had a friend of mine. He and I weren't actually even that good friends in school, but we happened to end up about 20 minutes away from each other. I think I talked to him every day for my first year. It's something that just to bounce ideas off of, look at business ideas. You want to have those people around you who are also going to be feeling the same things. I very much recommend that you're getting out in public speaking, and it's probably going to be things that you're not paid for. Maybe things like moms groups or doing seniors group at a church event or a senior center or something like that. First of all, it's great practice for getting out there and getting your name into the community. Health food stores are another great place for doing that. It's a way for people to know what you do and what you're passionate about as well. So I really, as much as people hate hearing it, I do think that people have to hear your voice to want to the office or come into your office and see you as a patient of yours. So the other thing that I would probably recommend is if you're in a community that has a lot of health food stores, I would probably pick one, maybe two, and try and cultivate relationships there. If you're trying to spread yourself really thin, it's probably not going to work out very well. You really have to make strong connections. Invite to take them out to lunch. Invite them for you to do a free talk for them. Really make those connections, especially with the people who are working on the front line, because those are going to be the people who are going to refer to you. They've got to know why to refer to you, though. Are you someone who is really passionate about kids? Are you working with women's health? Are you doing sports medicine? Are you an expert on the microbiota? They have to know why. It's not good enough for you just to be a new naturopath in town. There's got to be something there, and that one-on-one connection is a really good way to do that.
What do you say is the recommended dosage of probiotics per day for children and adults?
So there is no specific level. If we're looking at something like a lot of the stuff for kids that we see, the most common studies are going to be on L. reuteri protectus. Usually we're only getting about 100 million there. We are seeing in some cases Culturelle being used, which is that Rhamnosus GG strain, which is up to 1 billion at that point, but a lot of the times we're not using that much for kids. If we're treating things within the small intestine, so a GI condition, again, we may be looking at 10 billion, 20 billion, sometimes we're seeing up to 50 billion in the studies, but it's not necessarily huge amounts if we're thinking about the fact that we have about 100 trillion bacterial cells in the body. But most of that 100 trillion are going to be concentrated into the large intestine. So once we start looking at large intestine-based conditions, we are seeing in some of the strain-specific studies, we're using probiotics that are going up to 450 billion per dose, and sometimes we're using more than one dose per day. So the numbers can get a whole lot higher at that point. But again, it's really strain specific and it's really condition specific, as opposed to this is what we do for kids and this is what we do for adults.
Okay, what about probiotics when you are pregnant? How much?
How much?
Yeah.
Yeah, again, it's more what condition are you using it for? What is the reason? So one of the more common things that we are seeing is just in general is that using probiotics in pregnancy seems to have pretty decent outcomes for individuals just in general. It seems to be helpful for the mom and for the baby. Usually we're using fairly moderate doses on that, maybe 10 billion, but again, you want to use something where a strain has been actually studied. But if we're looking at the other side of it, a lot of the time we're using probiotics in pregnancy because a woman has had an infection of some sort and they've used an antibiotic at that point. And we are finding that there are great studies that are showing that there are better outcomes for women who have had antibiotics in pregnancy who have used probiotics as opposed to women who have not used probiotics. And often the studies that have been done are going to be fairly high dose, so 50 billion up to 450 billion, but those again are with very specific strains that we're looking at.
Okay, I found maltodextrin to be an added ingredient in probiotics. Isn't that an ingredient from corn, and why would they need it?
I think sometimes it's not as much a question of need as a question of cheapness as a filler. I think a lot of companies, it comes down to the bottom line of dollars, and corn is a very inexpensive subsidized product. I don't think a lot of things need to be put into any sort of supplement as fillers, and we find a lot of corn fillers in supplements just in general. But sadly, most of the companies are not interested, in my opinion, on what should be put in as fillers into their products. But I fully agree that I don't think corn has to be put into well, most anything on the face of the earth except for eating a piece of corn and perhaps tortilla chips, which are supposed to be corn-based. But most food products that have it in as a filler or additive, or supplements or probiotics that have it as a filler or additive, I really don't think that's necessary in any way.
Okay, well, it looks like all of our questions have been answered, and I would like to thank Dr. Bretz on behalf of the AANMC, and I'd also like to thank each of you for attending this presentation. This webinar recording will be available to listen on the AANMC website in about a week or so. So thank you for attending, and this concludes our webinar.